Some of Alberta's long-term care residents are enjoying an enhanced quality of life thanks to a new and innovative approach to managing the anxiety and behavioral challenges often associated with dementia. 11 long-term care sites across the province are helping to research, review, and implement new guidelines around the appropriate use of antipsychotic and sedative medications.
Antipsychotics have very appropriate uses, and people in long-term care appropriately need to be on them. But in addition, there are parameters that we use or screens that we use that indicate that there are some people who may be on them without an appropriate indication. In other words, the indication may not be indicated on the chart, or the drug may not in fact be the right drug for that person to be on. And so the Seniors Health SCN, Strategic Clinical Network, in collaboration with the Addictions and Mental Health Strategic Clinical Network, looked at the issue and decided that it was an appropriate area for further work.
Music, exercise, and art are a few of the activities being looked at as ways to moderate anxiety and behavior while reducing the use of antipsychotic medications and their unwanted side effects. Marshall Bai says it's made a tremendous difference for his wife Evelyn, who's been struggling with dementia for the past decade.
Evelyn's been one that's very, likes to joke a lot, and she still does. In fact, that's one of the things that I've noticed since she's been taken off the antipsychotics, that she's now joking again, whereas for a while she was not joking at all. Or she would show signs of aggression and severe aggressions. But with the new medication, she calmed down, and it's been that way controlled. It's very hard to control, and but the doctors here were able to do that, and it was just marvelous the way she responded, and without it, I don't know what would happen.
We have looked into the number of clients that we have that are using antipsychotics. We have reviewed their medication. It's an interdisciplinary approach, including the pharmacist and the doctors. We did not have to add any more staff. It's just them understanding and having a different approach.
6 months ago, Evelyn's condition was deteriorating. She rarely spoke and could barely recognize her family and husband of 60 years.
When she was under the medication, her eyes were very seldom open. Now she's open, and well, you've seen her sparkle. Her eyes sparkle sometimes now.
Now, after Evelyn's healthcare team reviewed her treatments, she's again enjoying her weekly music sessions, talking to staff, and listening to her husband's stories about their travels and adventures.
We had a very interesting life besides teaching. We traveled a lot, and we both traveled and enjoyed traveling a great deal. So, wonderful life, a wonderful family.
But one of the benefits AHS has, of course, is that being provincial, we can in fact look across the province and institute a program across the province to reduce use of these agents. And that's what we've done.